Hey guys, thanks for joining us. I'm here with Dr. Christina Hennessy today, and we're going through your responses to our Facebook request, which was basically for you to have a think about which new service and treatments you'd like to see on Lloydsonlinedoctor.ie. So without further ado, we'll get straight into it. First one up was Aoife Conway, who asked about potential eczema medication and skincare. This obviously being a big area. And she was saying that, you know, for repeat prescriptions for people who need skin treatment, is this something we could potentially do?
I think this is a great idea, and it's something that we already do on our UK site.
Right.
So I'm definitely keen to start doing skin treatments in Ireland.
Fantastic. Good start. Okay, next up is Rachel Kenny, and she said antibiotics. So particularly for the things you need every so often, for the ear, nose and throat, chest infection, that kind of thing. Antibiotics, is that something we'd ever get into?
I don't think we'd ever get into antibiotics for chest infections, sore throats, ear infections, because really most of the time these are caused by viruses and they don't need an antibiotic. If you think you need an antibiotic, then a doctor really needs to examine you.
Okay, right so. Next, Katrina Joyce. So she was talking about welfare and work certs for people who are off ill. Is that something we'll ever get into?
I doubt it. I think that would not just be our decision, actually. You'd need a government or an insurance decision on that one.
Right, okay. And also she was talking about the other interesting thing, herbal remedies for people who don't want to take antibiotics. A lot of people out there. What's your take on sort of us getting into that field?
I think we're an online doctor service. We're all trained in traditional medicine, and at the moment none of us have got any training in herbal medicine. So at the moment, I don't think we're going to offer any herbal solutions.
Okay. Next up, Rachel Douglas. She's basically talking about if we had a section for information, so providing information on drugs and medications, treatments. What are your thoughts on that?
I think that's a great idea. I really like that idea, and certainly we're looking to increase the information on the website.
Awesome. All right, Olga Foley up next. So she's saying that she'd love to be able to access a doctor live. So I guess this would be via Skype chat of some sort. Mm-hmm. Thoughts?
Yeah, good idea. Again, we're already doing that on our UK site, so I see no reason why we couldn't do it in Ireland as well.
Great. Agnes Hickey, she's asked for referrals for consultations to go to consultants. So I imagine this is rather than going to your GP and asking to be passed on to, say, an ear, nose and throat specialist, you come to us and we could do the same thing. What are your thoughts on that?
Usually the reason to have a GP referral before you see a consultant is because the consultant wants some information about your medical history from the past. Because we don't have that information, I think it's unlikely that we would offer this as a service. Okay,
cool. Karen Shevlin has asked for information on hay fever for children.
Sure, again this is around information, and I think we are keen to offer more information on our website.
Great. Tricia Redman notes that there's a lot of information on the Asthma Society of Ireland's website, and you know, we've certainly taken a look at that here and think it's a great place for specific asthmatic and allergy related issues. So next one, quite intriguing from my perspective, is Alison Ryder. So looking at packs for specific occasions. So she's talking about a family holiday pack with the first aid kit, basic medication items, or even a newborn baby pack with essentials. What do you think about that?
Yeah, I think that's a very interesting suggestion. Often quite useful to have a travel pack, I think, because many people forget to take certain things when they go abroad. Yeah. So if we could put it all together in a pack, I think that's a great idea.
And I know a lot of patients have come to us asking for malaria treatment as well, something we do a lot of in the UK, and that's something that will be on our list, I think our to-do list, so being able to provide that.
Yeah, good idea.
Cool. We've got Patricia Sutton talking about creams for eczema and so forth. I think this is similar to the previous one we had. Yeah. Same position on that?
Great idea.
So eczema treatment?
Yeah.
Cool. And Therese Bard, suffering from prickly heat. What is prickly heat and how do you treat it?
It's an itchy red rash that you get on your body, usually intensely itchy. It usually goes away on its own in a couple of days and doesn't need any treatment, but some people do take an antihistamine or even use a mild steroid cream. again, I think this is a question around offering information on the site.
Right.
So, and that is something we'd like to do.
So maybe the medication isn't the answer, it's just providing that information.
Yeah. The medication you can buy over the counter, you don't need a doctor's prescription.
Right, okay, cool. Sophia Peters is talking about basically gastro medication, so stuff for the tummy, and stuff that a lot of people need quite a lot. What are your thoughts on that?
I think a lot of people have gastric problems. Most solutions for this are either changing your lifestyle or buying medication over the counter. You don't need to see a doctor.
Right.
Having said that, we are looking at providing some prescription-only medicines, but we just need to be careful that there are no other more serious conditions going on.
Right, okay, great. Aoife Conway, back with heartburn and IBS. So again, she's saying half the country suffer from these problems and need continuous medication. And she makes it a good note there about it having to be properly investigated, and not BIDS, nothing more sinister. What do you think?
Really same as the first person. I think I agree, we need to be sure there's nothing more serious going on. People need to look at their lifestyles before they look at taking drug therapy. But yeah, I think there is a possibility that there are some gastric prescription-only medicines that we could start offering.
Great. Jacqueline Concannon, antibiotics for children. And I guess probably the sentiment here is, can we get antibiotics or anything for someone else on someone else's behalf?
Okay, I think antibiotics we've covered. I'm not keen to provide those except in some very narrow situations.
That would be sexual health treatment?
Yeah.
Right, okay.
And women's health. We do cystinitis treatment
as
well in some situations. In terms of buying from another person, in our site, you have got to fill in the questionnaire yourself and click a button, acknowledging that it is you that you're buying medication for. We don't offer any medication for children. Okay.
And last but not least, Caroline Conlon has sleeping tablets.
We're not going to offer that. Mostly, really, solutions for sleeping problems are not tablet related.
Right.
So there are a lot of reasons why we wouldn't offer sleeping tablets online.
Okay, great. So, time to pick a winner.
Oh, okay. Well, my winner is Aoife Conway.
Oh, Aoife. Okay, well done, Aoife. And why did you select Aoife?
Because she sent in 2 suggestions which I liked, but in particular the skin service. I think that's a really good thing that we could offer on the site.
Great stuff. Well, thanks everyone for watching, and we'll see you later.
Goodbye.